I think you're muted. Maybe. I'm sorry, the September 16th Ashland Board of Health meeting to order. The first thing on our agenda is citizen participation. Do I have anybody for citizen participation? Okay, I don't see anybody. All right, so the next thing on our agenda is the tobacco-free generation discussion with Zachary Rich. Raj, do you want to do any kind of introduction or?
Yes, sir. So Mr. Zachary was in, last meeting, and he was asked to present stuff on what we call as the nicotine-free generation, NFG. I guess there's 17 communities that have adopted this policy so far, and we sent some documentation that was provided by them, to the board, And I'll give it to Mr. Zachary, if you can brief the board on what is this regarding, go from there, please.
Excellent. I have a couple of slides, or I can do it just by talking, if that's okay with the board.
If you want to share your screen, that's great.
Okay.
There's usually a lot of people watching from home also.
Well, I sent a share request. While that's figuring out, I'll just introduce myself. My name is Dr. Zachary Rich. I am a lung doctor and critical care doctor that's been working with the nicotine-free generation group here for a couple of years and has been involved with other municipalities that has adopted this this legislation. Admittedly, I make my living and pay my mortgage by treating tobacco-related diseases, and feel very strongly about this issue. All right, there we go. All right, can everyone hear and see me? Excellent. So I just have a very quick presentation, just 5-10 minutes, and happy to answer any questions as they come up or at the end as well. Okay, so NFG policies, you'll hear me say interchangeably with tobacco-free generation policies, but these are commercial, these are policies designed to target the sale of commercial nicotine products and changing those to being a birth date legislation rather than being an age-based. So what this means in practically speaking is that anyone who can currently purchase nicotine products will always be able to purchase nicotine products, but anyone who is currently under the age of 21, the year to buy nicotine products would go up 1 year with them. So anyone who cannot currently purchase nicotine products would not be allowed to be sold nicotine products in Ashland. Whereas those that currently can purchase nicotine products, those that are over 21, will forever be able to purchase nicotine products in Ashland. I think it's also important to highlight what this legislation is not. So this is not related to ceremonial tobacco use or traditional tobacco use. This is purely commercial tobacco use. And these policies do not criminalize the possession or individual use of tobacco. This is purely enforced on the retailers of tobacco products in Ashland, with the design of preventing any sort of disparities in policing for people with individual use of nicotine products. These policies have been around for a while and across the globe. From the Philippines, it was passed in New Zealand and in the UK and in Brookline. Unfortunately, in every one of these cases, except for Brookline, these policies were then repealed. However, Brookline, Massachusetts, this was the exception where it was challenged in the courts and upheld. So I think this is really important to highlight why NFG is nicotine-free generation policies are so encouraging, is that they give time for both retailers and current users to adapt. So rather than a complete ban on tobacco products, this is a gradual phase out that provides an opportunity to improve the health of the following generation. Many times, public health has acted in what's the best interest for its citizens, whether it's regulating lead in gasoline or asbestos. I believe that nicotine-free generation is a very similar policy. When I see patients with advanced lung disease that smoke cigarettes, the vast majority of them wish they had never started smoking. I always hear people say, I wish I had never picked it up, when they were unfortunate victims at a vulnerable age to multinational tobacco industries. I've never heard someone say, I wish I could buy asbestos still, or I wish I could go buy some leaded gasoline. I also think that it's very important to highlight that really nicotine use disorder and tobacco use is really almost a pediatric problem, in that the vast majority of people who do smoke cigarettes started by the time they were 18, 90% by the time they're 18, and 98% by the time they're 26. So this really is a very vulnerable time for people to then go on and have a lifetime of addiction to nicotine. The really goals of nicotine-free generation policy is not only to limit the sale of tobacco to youth, but really to change the social norms of this, so that future generations really see smoking and vaping as, oh, that's something that the older generation did, and I get to benefit from knowing the harms that's associated with it. So just wanted to give a quick update on the progress in Brookline. So Brookline was the first to enact tobacco-free generation in 2020. It was challenged in the courts with support from the tobacco industry, but was glad to say that it was upheld by the Massachusetts Supreme Court. Much of this work was done with the aid of the Public Health Advocacy Institute, who has also offered to represent any municipality in Massachusetts that goes on to face a further legal challenge, of which I do not think there will be, given that the Supreme Court ruled on this previously. Since Brookline has passed this has spread to 17 different towns, including Hopkinton most recently, and is continuing to spread in Massachusetts, and our goal is elsewhere. I think a large reason that this has continued to spread is this is really a bipartisan issue. This is spread in both Republican and Democratic leaning areas, because there's really the same answer for when someone asks you, what age do you want your kid to start smoking? That's a similar answer no matter where you are. And these policies, I think, enjoy broad support. I think the goal is to be similar to the Tobacco 21 movement, of which Ashland was a very early adopter, that raised the age of purchasing tobacco from 18 to 21. And after Ashland adopted this Tobacco 21 legislation, it then went on to be signed into national policy by President Trump in 2019. I would invite you to, if you have the chance to talk to or engage with anyone in the Ashland school systems, I think you'd be surprised to hear the youth's thoughts on related to nicotine-free generation policies. So I would invite you to consider passing nicotine-free generation policies, again, which it changes the from an age-based to a date-based legislation to buy nicotine products. And I'm happy to answer any and other questions.
So I have a quick question. The other cities and towns in Massachusetts that passed this, was it strictly a vote of their Board of Health, or was their select board involved? Or was it a mixture?
Excellent question. So in Massachusetts, there's 351 municipalities, which means there's 351 ways of doing things. Some it was a Board of Health vote, some it was a town meeting vote. It's been a little different municipality by municipality.
Anybody?
Ashland was a Board of Health vote, similar to. Sorry, Hopkinton was a Board of Health vote. My apologies.
Okay. Anybody from the board have any questions? Jay?
Yep. Thank you, Dr. Rich. Are you talking about nicotine products or specifically tobacco products?
Excellent question. So the legislation that has been adopted by the 17 municipalities has been for all nicotine products, including vaping, as well as non-combustible nicotine products such as pouches, as well. It does not apply to products that are used as pharmaceuticals for nicotine use disorder, such as nicotine gum, nicotine patches, and nicotine lozenges.
Okay. And is there a way to go back to slide number 4?
Oh, sure. Let me take that over again.
I think it's 4, could be 3.
Showing the history of it.
Right.
Yeah.
Yeah. Go forward 1, or maybe yeah, that's the one there. So can you just go into a little more detail on what you know about this?
Yeah, I'd be happy to. So initially, the really kind of first place where nicotine-free policies were adopted was in the Philippines. One city in the Philippines, Balanga, had a very charismatic and impactful mayor that said we need to do more to prevent our youth, and passed it in the Philippines. It was very popular. Unfortunately, after it was passed, the tobacco company industry then issued a challenge to it, and it was unfortunately reversed before it was implemented. And somewhat of a similar story happened in New Zealand, where it was passed in New Zealand and passed in the United Kingdom as well. But before these policies could take effect, they were overturned through the courts. In Brookline, however, this has been the exception that it was passed in Brookline, and while it was challenged, the effect remained in place until the Massachusetts State Supreme Court ruled unanimously that it was legal, and it has continued to stay in effect in Brookline.
Okay, and it was challenged based on what was the argument?
In Brookline in particular, that was an overreach of that the municipality could not regulate tobacco sales at the municipal level, and that would have to cede to state tobacco laws.
Okay. All right. Thank you.
How has that been for the town of Brookline? Like, has there been polling done to see if it's had a good effect on the town itself? like a noticeable effect?
Excellent question. That is something I'm actively engaged in, but it is in terms of measuring if it's had an effect, it's still relatively early, given that it's only been in effect for 5 years now. I will say that there's been some concern of, oh, is this going to impact commercial retailers? And there has not been a single commercial retailer that sold nicotine products that has subsequently gone out of business since this was enacted in Brookline. I think I'm actually surprised that how some of the response that some of the commercial retailers have given, some that actually say that they say, I sell cigarettes. Unfortunately, I have to just to keep up with the other convenience stores. But I'm glad when this legislation was passed because I don't want to sell cigarettes at my store, but I feel like I need to in order to compete with other convenience stores. And now they're seeing that as a way of leveling the playing field and being able to not sell tobacco products and still maintain commercial viability. In terms of the impact of how impactful this has been on smoking rates in the youth and adults of Brookline, unfortunately, we don't have data on that fully honestly right now, but that is something that we are actively studying. What we can extrapolate from is with the Tobacco 21 movement, which similarly raised the age from 18 to 21 and was passed on a municipal by municipal level. There is evidence that that did have quite the impact on youth, that and that it was not the case that youth would just go one town over to get to buy tobacco. So looking at the evidence from the Tobacco 21 movement, I fully expect that we will, as we continue this research, see that it has had an effect in Brookline.
Okay, thank you.
Just a quick question. On like the towns that you said have adopted these policies, do you have a rough idea like how, if somebody sells like to, because we're going by date of birth, right? That's a cutoff.
Yep.
Any penalties or fines that have been coming along with it?
Yeah, every town can approach this differently. If in terms of what are the penalties, it's essentially most towns have decided to use the existing infrastructure of what is the penalty of if you sold to someone that is under 21 currently, and use that, whether that's what the financial or repercussions on their tobacco license would be.
Okay.
So Dr. Rich, obviously we cannot vote on this tonight. It's listed on our agenda as a discussion. And what I'd like to do is, we usually wouldn't do this, but if I see there's a lot of people here, I wanted to just see if anybody wanted to say a few words, either in support or not in support of this. But then what I think I would do is I would charge our health director to speak with our town manager to find out if this is something that they would like the select board involved with. Would they want to have a public hearing on it, just so that people could weigh in? And I just don't think right now we could not make that decision tonight. And and again, this is a great discussion item, but I think that might be our best way to go. I hope you would agree with that.
Completely agree. Yes. Yep.
Yeah. And is it Maria and Scott Francis? Do you go ahead if you'd like to say a couple of words?
Thank you, Ed. And thank you. Appreciate everybody for having this hearing tonight. Maria and I emailed the town and asked if we could have this discussion. So thank you, Rajit, for making this happen and getting on the agenda quickly. I'm a person in long-term addiction recovery, and I got to tell you, nicotine was the hardest addiction to have to overcome. You know, I've been able to, in fact, on Monday, I'll have 18 years without using alcohol and other drugs. And stopping drinking alcohol was not nearly as hard as the nicotine. And like when I had a return, I initially went into addiction recovery for alcohol on October 6, 2006. 10 and a half months later, I had a return to use when I traveled out in Denver for business. And then one more return to use next time I traveled. So that was, you know, a very quick return to use and then back into recovery. And so September 22nd, 2007 was last time I was at my first day. And but with the nicotine, you know, when I had a return to use, I didn't start smoking until 1997, and and I still till 2000, and then I'm sorry, I started in 95, quit in 97, was able to get 3 years without smoking cigarettes. And then in around 2000, I had a return to use, and that return to use lasted 6 years. It cost me so much money, and it cost me my health, and it was so difficult to overcome. So I like that question that what age do we want our kids to start smoking? I think that's a great question. And so that's my advocacy, is to consider passing the NFG legislation, because an ounce of prevention is way worth more than a pound of recovery. Okay, so thank you so much. And here's my wonderful wife.
I'm just going to say a quick thing too. Thank you, Dr. Rich, and thank you, everybody. And I'm also in mental health recovery and nicotine recovery and substance use recovery. And I also am a parent, and I've also worked in the mental health field. And I am really passionate. We have 2 kids here, and I'm also passionate for the other kids, the whole community, to prevent nicotine use, drug use, just to really have a healthy and happy community. And so I started smoking when I was about 14, and I just wish I never had access to it. And so whatever we can do to make it so that kids don't have access to it, that it just makes so much sense. This is our daughter. Her name is Fiona. She's 8. Hi. And this is Jack.
Hi. Although today, I've got something to say to you guys. I am Jack, and I am 11, and I am the Prince of Prevention. And when I was really young, my dad made up a saying, or was it me? I can't remember. And he said, if you don't pick up that first sucker, Jack,
You're doing great.
Okay, I've never public speech before. Sucker drug, then you can't get addicted. And the reason I am here today to speak, even though I'm not doing a very good job, but I'm trying my best, is because I want you guys to pass the law of the nicotine-free generation.
Yay, Jack.
Thank you, everybody, for your time.
Anytime.
Thank you. Anybody else? Okay, so
Sorry,
Raj.
Ed.
Oh, sorry, Amy. I didn't see you, Amy. Sorry.
No, well, I have a new laptop and I was trying to figure out the right hand raise, and I'm not very good at raising my hand, so I'm sorry about that. So great to see everybody. Amy Turncliffe. I live at 21 Rossi Lane. I have lived in Ashland for 20 years. I have 3 kids. They are 18, 16, and 13, so all teenagers. And I started working in the mental health and substance use disorder space more than 20 years ago. And I started with Ashland Decisions at Every Turn Coalition in 2010, so now 15 years ago this year. I want, if it's okay, just take a minute to thank Maria and Scott and your family, because I was you many years ago, and I'm so grateful. I used to start these conversations, and I'm grateful that it didn't have to be me this time. So I would love to touch base offline. I am speaking in support of nicotine-free generation. We know what works in prevention. We often don't do it. Our policies are our best prevention. So I would ask that all of you seriously consider passing nicotine-free generation, joining those 17 communities, including our neighbor Hopkinton, who have done that. I chair the Metro West Substance Awareness and Prevention Alliance. I am past director and past co-chair of Ashland's Decisions at Every Turn Coalition. And coalitions around the state are continuing to have this conversation about nicotine-free generation. To me, it's a no-brainer. I mean, enough chronic illness, death, early premature death have happened that I think we've reached a point that don't we all want an addiction-free future? And I think my kids might fall in the age category if we move quickly, and certainly Maria and Scott's children would. So again, thank you for initiating the conversation. Thank you for having the conversation, and I am here to support the nicotine-free generation policy movement as needed. Please let me know. Thank you.
Thanks, Amy. I do have one other quick question for Dr. Rich. Dr. Rich, if we were to adopt this, is there any kind, I don't know if you offer it or something, is there any kind of educational component that starts with our middle schoolers?
Yeah, so again, every municipality has done it differently. We have a really great team of public health nurses that are excited to come and do exactly that. I can just tell you, when we were at this position with Newton was deciding about similar, how should we implement this, and they did a public hearing and did a vote with the Board of Health. But they actually said, we don't want to wait till January 1. We want to start it next month and start having the education as well as the nicotine-free generation implemented. So there is a lot of flexibility, municipality to municipality, but anything we can do to help. We have a small but very dedicated team of lawyers, physicians, pharmacists, public health nurses, that we're happy to help however we can.
Thank you. All right. So again, I want to thank everyone for joining us. Again, I'm going to ask Raj to reach out to the town manager to see how he would like to proceed. Again, we might need you again if he wants to do a public hearing, make that available to people, or just see which route they want to go, and then we can be in touch.
I'd be happy to come back in person, Zoom, however, and really happy to help however I can.
Great. Raj, you good with that?
And I'll follow up with the management, Mr. Manager, tomorrow or whenever
Sure.
he's the next, so we'll start that conversation.
Sure. And my fellow board members, is that good for everybody? I'm
Yes.
seeing nods. I guess that's great. Again, I want to thank everyone for joining us tonight and appreciate the presentation.
Thank you so
Great.
much,
Thank you for
everybody.
having me.
Okay, so the next thing on our agenda is Ashland Day at Stone Park on October 4th. Raj?
Chief, the only thing I have on this, right? So we have a lot of vendors apply for the food permits on this, right? We have so far we have 11 permitted vendors that we have already permitted. There are 2 applications we're currently working. That one we might have to deny based on the facts, right? That the person don't have a base of operations. We have spoke to him today, asking for that to provide that, So that's that. We have 2 new vendors that are on the list now. They're going to be one YAMCA truck there where they're going to be doing some food show kind of situation, and then we're going to have one animal permit, we say animal zoo coming for the Ashland Day.
I'm so sorry to interrupt. I see that I was made host, and I didn't want to leave and have the meeting end for everyone else. So.
Oh, yeah. Laura, can you take the host back?
Good afternoon. Thank you. I appreciate it.
Thanks.
And I'll be in touch with you, so I'll keep you posted next steps, so
Excellent.
hear from you. Thank you.
Okay. And then Raj, looks like we go right into your report next.
Yes, sir. Thank you. So so far with the fall flu clinics, right? We had two of the clinics that was this past Monday and the one before. This is with the Pine Hill Pharmacy. Where only thing is, right, like the attendance on this clinics was a little lower side, compared to the past year, So, but we have two scheduled for October. Besides this, we have 40 doses of free flu vaccines that we give it to our, and with the people with no insurance or under insurance, so we are doing that. And we're continuing with our Wednesday and Thursday clinics where we are doing our childhood vaccines, and then we're going to do the flu then as well. With a shadows shelter, I know the director, Mr. David, was here in front of the board last meeting. So from that time, I have done an inspection on the housing part of it that we had, and all the violations on the housing part are now cleared, and we have closed that. We did hear back from the state Commonwealth of Massachusetts on the same complaint, that they have forwarded to us, that they also received the complaint. On the food part, I have not heard from them, and I'll follow up, where they're on the permitting of the food. So that's still pending. With Seasons Market on 123 Union, we had a complaint from Mr. Morgan last month that we have addressed. They have sprayed the property a couple of times for mosquitoes and have cleaned up around the property. So that we all set on that. With the complaint on Ashland Ale House 135 discount that was sitting on with us for good amount of 6 months, I guess, right? So that's closed again now. And I know Mr. Morris have asked me for the report, and I forwarded to the board. Mr. Morris, are we okay with that? We got the report from them on the environmental side. I don't know if you need any more follow-up on that, or was that sufficient?
No, that was great. Thank you.
Wonderful. I just want to make sure, so that we are okay on that,
Yes.
With the unpermitted chickens roostered at 237 Pleasant Street, that also we picked up this in July. The occupants since have come in, have told us that the rooster is gone, but there was some conservation involvement, and the conservation department have asked them to file for an RDA. And I guess this is where we are, we're still waiting. We have given them the permit application, and I will follow up on that. Chief, go ahead, please.
Yep, sorry, Raj, while we're talking about roosters, and for the board, last week, Donna Walsh approached me. She had 3 roosters that were found abandoned, and she had them at the kennel for a short time. Not really, didn't know what she could do with them initially. And obviously, she was caring for them. But I guess at our kennel, she's not technically permitted to have roosters there. So she might be coming in front of the board. Raj, I told her I would talk to you about getting some kind of waiver in the event this happens in the future. So can we maybe work on that in the background somewhere so she has something to work with?
Absolutely, Chief. I guess, they are the same birds, right, that was dropped on Elliott Street,
Yeah, right.
We did had a conversation about this, so somebody have abandoned them on the Elliott Street, and I know she did get hurt also catching them, so
yeah.
But yes, we'll work on that, the best way how to handle that. And
yeah, she just wants to make sure she's in compliance, if somebody filed a complaint or something. So she would need some kind of waiver or something, but maybe the 3 of us could work on that offline.
Yeah, I'll speak to her tomorrow, and present in front of the board next time.
Great, perfect. Thank you.
Thank you. With the housing cases, we have 2 open cases at Joint Drive. Out of that, 1 was inspected, and I'm just waiting on the pest control report. The other one, I have to go do re-inspection, so this at the unit 35. With 242 Main Street, this is one of the housing cases that we have now completed and is closed the case. Last week, Wednesday, Thursday, Friday, I was out in Plymouth attending the Yankee conference. Some good stuff to learn, new stuff. We had both the commissioners, both from DPH and DEP, talk to us, about the current situations about public health or what's new going on. One thing from DPH side, that there is a food software that they'll be providing us. It's called Matrix, that we might be interested in getting along with the OpenGov that we have. We had some challenges with the permitting part of the OpenGov, so we'll see how the finished product, when we have it, comes to us, to use for our food inspections. Other thing on training, I have a 5-day training that every Monday that I'm in Needham Health Department, doing a tier 3 housing training from the state. That's through our training hub. I have already attended 2 sessions last 2 Mondays, and I have 2 more coming. And the 5th one will be, one of the training hub trainers will be coming to Ashland to go with me on one of the housing cases in Ashland. So that's on the trainings. Arbovirus report, I did send the board updated today. So far, we have 436 West Nile mosquito positive samples and 23 mosquito positive samples for EEE. And in the state so far, we have 4 cases of West Nile of virus. The blood donation drive we had on September 26, I'm sorry, it's the wrong date. I guess it was August 26 last month. We had the blood donation drive. Sorry about that typo. We had 20 units donated, and then we have scheduled our next blood donation drive at the community center. It's tentatively scheduled for January the 13th. With the disease investigations, we did pick up a case of Hep A today that we're looking into. Last week, we did have a kind of weird suspected rabies case that didn't turn out to be rabies. We looked at very different angles, was complicated. The patient was intubated, looked like it might be some sort of arbovirus, but didn't come positive for anything, So that was one of the other disease investigation we was doing. And besides that, we had 2 open TV cases that we are working on right now. And most of that, Anne handles, TV and everything, so, and I'm open for any questions for now.
No one? Okay. Oh, did someone have a question? No? Okay. So the next thing on our agenda is I would need a motion to approve the consent agenda, which will include the budget reports for the fiscal year 25 year to date and the meeting minutes from August 19th. Do I have a motion?
Yeah, I'll make the motion to
Okay.
accept the consent agenda as written.
And I will second it. Does anybody have any questions?
No.
Okay, all in favor?
Aye.
That's
Sorry.
unanimous. Great. Next thing on our agenda, discussion future agenda items, tobacco regulation review. Raj?
If this is on my end, still some more time I need, right? And then I don't know if we have to do the nicotine-free generation. We might be looking at it together, So
Okay.
That's still at my end, some more digging to do, But I
Sure.
will be back with the board on that shortly. There are a couple of other regulations that we might have to look, right? The well regulation, that it's quite some time that we have not looked into, right? Especially the heat wells and all that, heat pumps that nowadays a lot of folks are doing, though Ashland we had few installed, that we might have to include that in our well regulation, So a couple of other regulations to be looked at, but we're definitely working on it, so, but I'll be back with the board on that soon.
Yeah, I agree with Raj as far as nicotine-free generation. I think that is it's not trivial, and we need to deliberate on that. So I would say put it on the agenda with the tobacco regulations or whatever, or however, but to discuss.
Okay, so our next meeting looks like we're scheduled for October 7th. So Raj, will we have that meeting, or are we gonna wait and see if we have enough for an agenda?
I can discuss with that chief, and then
Okay.
we'll accordingly, but meanwhile,
Sure.
I work on the items, and
Sure.
then back to your board, to the
Okay.
board.
All right, does anybody have any new business or old business? Okay, then I will need a motion to adjourn.
I'll
Okay,
make a
I will
motion
give
to
the
adjourn.
motion to adjourn.
Okay,
I
Second.
second.
second. All right, thanks, everybody. We'll see you at our next meeting.
Thank you
All
very
right.
much.
Okay.